Hello, everybody in Facebook land. This is Leslie Lockhart with Abbington Life Magazine, and today I'm here for my Real Talk series with Dr. Jay Kitzmiller of Apex Dental Group. He is a Abbington resident, in case you didn't know that, and has been a longtime sponsor of the magazine, and I can't wait to talk to him and learn more about his practice and tell you all about it. So, hello, how are you?
Fine, Leslie. Thank you for having me here today. We appreciate it.
Yeah, so tell us more about you, how long you've lived in Abington, how long you've had your dental practice, and what does a dental practice do?
Yeah, we came in Abington. I moved from Sanford and was looking for a place over here because it was so far from practice. And we actually love Abington, and it had great things for our kids to do, lots of great neighbors. We've made lots of great friends, white princess dads together, and all sorts of fun things. So we really love Abington. I'm a proud sponsor of the swim team. Hopefully we can get that back up and running. But so we love Abington. Um, we came here after a ski trip, moved to Apex, and thought about, well, maybe this is the place to open up a practice. And so I really stopped off, and they had the Apex Fall Festival. And so we dropped in there, and we said, wow, this is absolutely fantastic. And I said, this would be a great place to open a practice. And so many years later, here I am. It's hard to believe how fast it's come. There was only one or two stoplights in town when I got here, but it's the growth has been phenomenal. I love it here.
Awesome. And where are you located?
We are right in the Apex Medical Park, right between the hospital and Carrabba's. It's a great location. The parking is very easy to do, and that's one of the reasons I moved in here, because it was such a great place.
And it is a very nice office. You have like a beach theme going on.
Yeah. Well, I can't take all the credit for that. My hygienist render wanted something beachy. So the designer I had helped me with the office got a little beach sign. So I do have one room, though. It's my hockey room. It's Hurricanes hockey, so it's got a theme for that. So that was my one influence on the rooms. But it's kind of fun. We're trying to make it a little more personal, make it more fun, because we love it. We love it when you come here and you're a little more relaxed.
So what all services do you do in the spectrum of dental work? At what point do you have to send them to somebody else?
Well, as my career, I was in the Army prior, and I've done 2 residencies, which is a great asset. I was able to work with dental specialists that work on gums, oral surgery, endodontists that do root canals, periodontists that work on the gums. And I was able to work with all these specialists and really do a little bit of everything. There are some things that I enjoy much more, but for the most part, I can do a lot of the things that that patients desire, and so they don't have to be sent off to different places. Very much a much better way to go if you're looking for a place to really call home.
Mm-hmm. And I know that the world is crazy these last 6 months. So what have you had? You were closed for a while.
Yeah.
Um, there's a lot of liquids and body fluids and dental work. So how have you, adapted to all that change?
Well, the great thing about dentistry, we've always been on top of it from the very beginning. So we've always had masks. We've always had some sort of gown or covering or garb. And face shields we've had, in safety glasses to help us. So from that perspective, our disinfection has always been pretty much almost what we're doing today. Now we are changing some of our social distancing in the front office to help keep that distancing and wearing of masks. So when you come into our office, the first thing we'll do is make sure you got your temperature taken so you're not running a fever. We don't want anyone with a fever in the office, obviously. And then once you do that, you're pretty much brought immediately back into the room. So our reception area is never really filled.
Mm-hmm.
So that makes it nice. So in the operatory, we have some high-speed evacuation and suction devices, which help get rid of all the aerosols from the area. And then I have another device which will insert in your mouth, which also provides more suction. So most of the aerosols are really going down inside of the rooms. And then, of course, we have lots of turnaround time for the disinfectants to do their job to kill the virus. So it's a very safe environment. And we're really trying to work with patients if they do have any conditions, that we get them first thing in the morning. That is the lowest risk time. And first thing maybe after lunch, but I really recommend first thing in the morning to get them in.
Okay. And I've been a couple times, I'm a patient there, so I've been a couple times during this period, and I felt very safe. And it's actually a lot less work for the patient. We don't have to spit out anything. You just do all the work for us.
That's right. It makes it more fun. We try to have fun. Fun is key
Yeah.
when you're doing dentistry because
Fun
other
at the
people.
dentist, as fun as it can be anyway. But you got to add those foot massages. Come on.
Yeah.
And wait for that. Wait for that. So is there anything else we should know about your practice before we talk about some other stuff?
I love to work with kids and families. So I try to work with the kids when they come in at their first visit at age 1. Not that we're going to do anything, but bringing the kids in early helps us establish a great relationship where they learn dentistry is a fun thing. It's not something that you're coming for a major procedure and then you're scared. So a lot of my kids, when they come in when they're young, like you, they really, really, really are good patients here because they've learned. And of course, we always get to bribe them with some prizes. We have a little
Mm-hmm.
coin machine to kind of get that going. So I love placing implants from start to finish. I have a very high-tech practice. I use a lot of digital scanning. We can make our crowns in a day. So if you have a crown that needs to be done, so you don't have to come back for that second visit, we'll actually make it here using CAD CAM technology and actually not digital printing, but it's digital milling, which is exactly the opposite. So we love the technology, and we would love to show you how that works.
And I know you're always doing like conferences and educational trainings and stuff of the latest stuff out there for dental. So it's
Yeah, and in this digital world, if you don't keep up, you'll never make it. If I had imagined when I started dental school that I was going to be doing crowns in a day from a computer, I think people would have laughed at me. Um, the
the
implants,
future.
yeah, the future is definitely digital dentistry. Implants, even I'm placing these digitally through a 3D X-ray, 3D cone beam X-ray, so I can actually see where this implant's going to go, and I can actually place it perfectly and create a guide to avoid all those structures that we don't want to bother, like the tooth next door, or any nerves or any vital blood vessels. So the amount of fun that we have here with the digital is truly amazing.
And we will be, just as a plug for something future, we're working on this like virtual wellness expo that I'm putting together. So y'all are going to do a video about your CEREC and
Yes,
anything
it's
else.
gonna be exciting. Just to watch it, then I still, every time I go up and watch a crown being milled on my machine, I'm still amazed that we are still doing this now, and even though I've done hundreds and hundreds of these crowns.
Good. Awesome. So tell us about some like hobbies of yours. I know you love the hurricanes. I know you love going to the mountains. What are some other things? You love going to Colorado, right?
Yes, we being in the military, we got to go lots of places skiing, so I picked up skiing. My wife is definitely the better skier than I am. Hope she doesn't see this video, but she's definitely the better skier. I'm just a little stronger. That's all it is. I'm just a little stronger. She's much more elegant in her skiing. But we love to go out in Colorado and ski. We love to hike in the North Carolina mountains. The hiking out there is incredible. Stone Mountain, Asheville area. There's so many places. A little bit of rafting in the area and tubing is extremely fun. And I love to fish with my brother-in-law. Now we go up to Virginia in the Intercoastal Waterway to fish. We do kind of a fly fishing, which not the same as you might think, but it's fly fishing nonetheless, and we catch a lot of fish. So those are the kinds of things I love doing outside of dentistry, and that's pretty much what I fill my time in. Probably the most important thing now is for me is I'm the leader of my church at Jordan Lutheran Church here in Apex. So we're starting to build a new church, and as we're building this,
Right across from Abbington, right?
yeah, it's in Beaver Creek. It's pretty much right across the street. They have that new light they just put in, and it's that new section over there, right on the Beaver Creek Commons Drive. So we are so looking forward to starting the church. Pastor Mike Merker is absolutely phenomenal and a great leader and a great pastor.
Do you know what the timeline is on that?
We're looking to right now to get permission from our congregation to start building, and so hopefully within the next 3 months they'll be able to start building, and from there, and you know how construction goes, it is what it is, and when you start you're good. But
Yeah.
we are definitely ready to go, so we're all excited.
Awesome. And you also play softball.
Well, I'm an okay softball player. My softball days are long gone. I have a team I sponsor. I still love to get out there. I love athletics. So the main thing I'm doing now is lifting weights and making sure that I'm at least keeping fit that way. But we got a fun team, and we go out and we play every Monday and Wednesday with the Apex Recreation. So it keeps me busy for sure.
And before we wrap up, tell us about your family. So I know you have two wonderful daughters and a dog.
Yes, I really owe a lot to my wife, Becky. She has been with me through the practice when we opened, and really has been a stronghold for me in the practice and taking care of the kids at home. So I have an older daughter, Katie. She's in Pittsburgh, University of Pittsburgh.
Yay!
Yay!
My first intern for Abbington Life.
Yeah. Yes, and she's awesome. My other awesome daughter is Aaliyah. She's at Apex Friendship High School, and she's a senior this year, so she'll be finishing up. Hopefully, we'll have some fun memories during this COVID time, and we hopefully she can get through that all right. I think
Yeah,
she will.
hopefully
She's
she has
a
an
lot
actual
better.
graduation next year.
Yeah. So some of the things that we are doing for our practice before we close up, we're having a giveaway, and it's for also on the left here. It's Halloween, and it's kind of fun because all right, we're giving away candy. So let me finish before we get there. What we have is you can eat your candy, but there's a electronic toothbrush in here, a really nice toothbrush to make sure that you're keeping clean from all this candy. So you got to guess the number of pieces in there. So come on and join our practice, and you can enter that. On the other side here, for every referral we get, we have a nice gift basket. And in this gift basket, there are cards for restaurants and Target and those kinds of things. So we're really looking forward to having a drawing for that too.
Awesome. Well, it was so nice to talk to you, and we will be looking forward to that video in the virtual wellness expo that I'm doing, and a wonderful fall ahead.
Yeah. Thank you, Leslie. You're so awesome. You're an awesome patient, and you're an awesome representative for me in the Abbington Life
Oh,
magazine.
thank
Thank
you.
you.
You're awesome too.
Thanks.
All right.